A warmer winter kicked off an early allergy season for many people in the Piedmont.
And sorry to say that sneezing may not end anytime soon. Fox 8's Shannon Smith has some advice for you and says you don't have to call a doctor right away.
For millions of Americans, spring brings sneezing season year after year. But for some, the itchy, watery eyes and runny nose may appear out of nowhere.
You could have spent most of your childhood with no allergies and get into your 30s and 40s, and all of a sudden you have an allergy to pollen or ragweed.
Dr. Joy Greene, a professor and associate dean at High Point University, says a pharmacy should be your first stop to find relief.
When you walk into a pharmacy, it can be overwhelming because you're looking at what's on the shelf. You see decongestants, antihistamines. How in the world do you know what to purchase? So you definitely should talk to your pharmacist.
Dr. Greene says over-the-counter allergy medicines fall into three categories. First generation includes Benadryl, which can be effective to fight mild to moderate symptoms, but can cause drowsiness. The second generation came out about a decade ago, Claritin and Allegra. They provide similar relief with fewer side effects.
But now if you're being affected by allergies most days of the week and it's causing you not to live your normal life, then you want to think about one of our steroid nasal sprays like Nasacort or Flonase.
Those are one spray once a day in each nostril. Dr. Greene says pharmacists can offer free advice on which medication would work best for you.
Always find out too, like what medications are you taking, because you want to make sure there are no drug interactions or side effects that you should be aware of.
And one other thing to keep in mind, if you've recently moved to North Carolina or even a different area in the Piedmont, you could notice new allergies, something you were not exposed to before.